Hello everyone, welcome to ITLS Academy. I'm Ronan Fatma and today we will discuss the part 2 of anaerobic bacteriology, that is about collection, transport and processing of clinical specimens. So from the first slide, we will first discover what we have already covered, okay? So the first point here is specimen must be collected correctly and transported quickly to the lab. Delay or improper handling can lead to the contamination with unwanted organisms. Okay. Now, the second point, if the sample is collected incorrectly, the lab results may show normal flora rather than the actual disease-causing pathogens. Third one, what we have learned is gram sealing gives fast information about whether the specimen is appropriate and what type of potential pathogens may be present. Okay. And the fourth point, what we have learned is lab staff should provide proper training and guidelines to the healthcare workers on how to correctly collect and handle specimens. Okay. Fifth point, what we have learned is the best practice is to inoculate the sample directly into the culture media at the operating room or bedside, but this requires adequate training to the staff, okay, of the staff. Sixth point, what we have learned is if bedside inoculation is not feasible, okay, if it's not possible, then specialized anaerobic transport media that is provided by the lab should be used to preserve the organisms until they reach the laboratory. Okay. So in the part 2 of anaerobic bacteriology, we will discuss in brief about specimen types. What are the transportation methods? What are the processing, how specimens are processed clinically, and about the microscopic examination in detail. Okay, so let's begin with specimen collection. The best specimens are chosen are preferred, are selected based on these three qualities that involves collection of the specimen directly from the site of the infection. Okay, the specimen collected should utilized, or you can say the specimen collected uh, must be used sterile techniques to avoid the areas with normal microbiota. Okay, and the preferred specimen collections of anaerobes are aspirates that are taken via needle and syringe or from tissue or biopsy samples. Now we have already discussed that swabs are generally discouraged or even rejected in some cases, but here are the problems mentioned. It involves low specimen volume. The organisms generally adheres to swab fibers that reduces the chance of recovery of anaerobes in the laboratory. Okay, and they are often considered as superficial because they increase the contaminating normal flora. Okay, now the last point is flocked swabs may improve yield. That means they are considered in the laboratory, but their evidence are reported at very low scale. Okay. Now, acceptable specimens. These are the acceptable specimens of anaerobes that are taken from these areas. Let's discuss in detail. From the area of head and neck, abscess aspirate is taken from the surface uh, sterilization or discontaminated areas and from the surgical biopsy materials. Okay, from the lungs, Transtracheal aspirate is taken, materials from percutaneous lung puncture is taken, biopsy materials are considered, thoracotomy and bronchoscopic specimens are considered, and bronchoscopic specimens must be taken from protected brush. Okay, and the central nervous system abscess aspirate are considered are best as best specimen and the specimens taken from surgical biopsy. From abdomen, peritoneal fluid, abscess aspirate, bile, and biopsy specimens are generally considered good. Okay. From urinary tract, suprapubic aspirate are considered good. From female genital tract, endometrial aspirate are considered best as specimen, and that must be taken via suction or via protected collector. Caldoscopy, biopsy material, abscess aspirate, and IUD for actinomyces are considered as suitable specimens for anaerobic recovery. From bone and joints, aspirates are considered best, but it should be taken via needle and biopsy materials. From soft tissues, aspirates must be taken from needle, biopsy materials are taken. Sinus aspirates taken. Deep aspirates from wound margins and surface ulcers are also considered best for anaerobic recovery, but these must be taken via discontaminated skin. Okay. Unacceptable specimens, these are the same areas that we have discussed for acceptable specimens, but these specimens are generally not considered for the extraction of anaerobes. Okay, so what are they? From the neck and from the head and neck, these are throat, nasopharyngeal swab, gingival swab, superficial material via swab. From lungs, sputum, endotracheal aspirate, bronchoscopic specimens that are especially not considered for anaerobes, and bronchoalveolar lavage. From the central nervous system, central nervous system, aerobic swabs are generally not considered. From abdomen, aerobic swabs are not considered. From urinary tract, voided urine, catheter urine are not considered. From female genital tract, vaginal or cervical swabs are not considered. From bone and joints, superficial materials taken via swabs are not considered. From the soft tissues, superficial material via swabs from skin surface or wounds are generally not considered. All right. So let's start with our just a second. Okay, so let's start with our next subheadings. Specimen transport. Okay, specimen transport. First of all, what this specimen transport involves? Time and volume. Why time and volume? Okay, because transport time depends on the volume and nature of the specimen. And large volume of the purulent material and large pieces of tissues maintain the viability of the anaerobes for many hours. Okay. The second point is small volumes and using swabs or biopsy materials generally considered to be transported via anaerobic transport device. Okay, what are the precautions we must take? First, we have to avoid extreme condition of heat and cold, and if the processing delays, we should keep the specimen at room temperature. Okay, we should not transport our specimen in needle or syringe. Okay, why? Because there is needle stick hazard, and specimen may leak or expel, and it increases the risk of personal and environment both. Okay. Now, What are the recommendations for transportation methods? Here are the four specimens for which we have to take different transportation methods. For aspirates, we must consider that aspirates should be transferred to anaerobic vial. For large pus and tissue, sterile tube is preferred. Okay. For tissues, for biopsy materials, for curating, sterile tube, dish, or anaerobic transportation bags are generally considered. Okay. For swabs, we generally avoid swabs. Okay, we generally avoid using swabs. But if its use is unavoidable, the specimen must transported via transport tube with anaerobic transport medium. Okay. Now here in this particular slide, we will discuss about the anaerobic transportation system. Okay, specimen transportation system. Okay, for here we have mentioned the. Just a second. Here we have mentioned the specimens. Okay, we have mentioned the transportation system, and here we have mentioned the available commercial systems. Okay, so for aspirated material, vial tube with anaerobic atmosphere plus agar base with indicator system are considered. Okay, for example, the available commercial systems are port Acal tube or vial by BD company, anaerobic transport medium by anaerob system, and ACT transport tube by Remel. Okay, for specimen tube, tissues, biopsy material, and the curating system, the transporter system must include special bags, tubes that remove oxygen, and or even allow adding materials. Okay, the commercially available transportation systems for tissue biopsy materials and curatings are biobags, anaerobic transport system by anaerobic systems, ACT transport tube, anaerogen, anaero pouch, and Venturi trans system, port acal, wide mouth jar. Okay, and for the specimens, swab specimens specifically, that we generally are not considered. The transportation system must involve tube with anaerobic atmosphere with agar base with indicator as well, and or transport medium with reduced oxygen level. Okay, what are the available commercial transportation systems? For swab specimens, there are anaerobic transport system by anaerob systems, ACT transport tube, port Acal, BD, and Venturi trans system. Okay. Now in the present slide, we will discuss about the suggested specimen time for specific volumes, okay, and their transportation methods for aspirate materials. If the volume is very small, that is less than 1.0 ml, the optimal time is less than or equal to 10 minutes. Okay, it is best if it is transported in anaerobic vial. Okay, for small volumes, that is around 10 ml, the optimal time should be less than or equal to 30 minutes, and it must be transported in an anaerobic vial for better recovery. Okay. For large volume of the specimen that is greater than 10 ml, the optimal volume must be greater than or equal to, it must be, sorry, less than or equal to 2 to 3 hours. Okay, it must be less than 2 to 3, less than or equal to 2 to 3 hours. Okay, and the transportation method must involve that there should be use of anaerobic vial if possible, and otherwise it's a sterile container. Okay, and it must be processed quickly. Now for the specimen tissue or biopsy materials, uh, if it is taken in a sterile container, the optimal time must be less than or equal to 30 minutes. Okay, and if it is taken in an anaerobic bag or tube, the optimal time must be less than or equal to 2 to 3 hours. Okay, we must take care that large tissues or purulent tissue pieces must work well. Okay, sometimes they can be recoverable even after 8 to 24 hours. Okay, if they work well. Okay, for the third specimen that are taken via anaerobic swabs, generally they are not considered, but if they are used, that must be transported via moist anaerobic tube, and the optimal time must be less than or equal to 1 hour. Okay, and anaerobic transport medium should be used, if it and the optimal time for the same is less than equal to 2 to 3 hours. Okay, it is not ideal. We already know that, and should not be used for operating room. Okay, operating room specimens. Okay. In this slide, we will learn that there are different collection methods of specimens. Okay, so for abscess, aspirate materials are taken via needle and syringe after the disinfecting the surface with povidone and iodine that must be in contact for at least less than or equal to 1 minute. Okay, and if needle is contraindicated, there should be use of flexible catheters or syringe without needle. Okay, for sinus tract, deep wound drainage, the specimen must be collected with a small flexible catheter with syringe after the skin is disinfected. Okay, and the alternative method is curatings of materials from deep within the tract or wounds. Okay, for decubitus and surface ulcers, routine swabs are misleading. That's why they are considered as not, and they are considered as inappropriate. Okay, and the special, but it can be considered with special precautions. Okay, for acceptable, there are acceptable specimens in the particular specimen that involves punch biopsy, aspirated material that is extracted via needle and syringe after the surface disinfection, tissue curatings at wound margin. Okay, but the problem here arises that there is the overgrowth of the true pathogen along with the other microbes. Okay, that rapidly grows along with the overgrowth of the particular true pathogen. Okay, and the next issue is PCR is too sensitive, and the culture also often considers as inaccurate. Okay, that means culture often provides inaccuracy in results. Okay, for pulmonary specimens, lung tissues must be collected via shielded double lumen catheters. Also, transtracheal and transcutaneous aspirates and bronchial brushings are used. Okay, and the specimens needed to avoid contamination with normal respiratory microbiota. Okay, otherwise the results will be inappropriate. Okay, bronchial washings or other respiratory specimens without lumen catheters are generally not considered as appropriate. Okay, for female genital tract, uh, the specimen must disinfect cervical opening by swab using povidone plus iodine. Okay, use of double lumen collector system is considered. What are they? They are pipeline system that obtains cellular materials via suctioning uterine wall. Okay, acuculture that reduces contamination, and laparoscopy, cultosynthesis, or surgery are also considered as appropriate. For specimen, for culture intrauterine devices, the of actinomyces species are considered. Okay, and it must be incubated with that less than 10 to 15, less than or equal to 10 to 15 days to recover anaerobes. Okay, and it also there should be a correlation with the pathogen findings. All right. So the culture of intrauterine devices are generally considered for Actinomyces species, and we have already discussed that it must be incubated within or equal to 10 to 14 days, and generally correlation is uh, always considered for pathogen finding for better anaerobic results. For urinary tract, best methods considered is suprapubic bladder tap. Okay, for orthopedic specimens, it should submit synovial aspirate, synovium biopsy material, or joint tissue, but very quickly to the laboratory. Okay, we can also process the specimen, multiple specimens separately to distinguish pathogens versus contaminants. Okay, for prosthetic joints, sonication can be done. Okay, and here it delivers whole joint in sterile Nalgene container that is large enough to contain the whole joint. Okay, from the operating room. Okay, the last one is other situations. For other situations, if aspiration or biopsy is not possible, for example, for animal bite wounds, there must be use of anaerobic swabs that are generally not desirable. Okay, we have already discussed about the issue. They involve low volume, contamination risk, dryness, adherence to fibers, or poor gram stains. Okay, best option here we consider this considers are polyurethane swabs, two swabs, one for culture and the other for smear or log swabs. Okay, and the most preferred specimens are aspirate material or small tissue silver, small tissue fiber instead of swabs. Okay. A brief introduction about specimen. Let's start with processing specimens for anaerobic culture topic. Okay, so about visual examination, gross inspection reveals the information about the quality of the specimen for blood, purulence, yeah, purulence, necrotic tissue, foul odor, and sulfur granules. Okay. Now, for the preparation of specimen, specifically for purulent specimens, we generally vortex the specimen in anaerobic vial for the even distribution. Okay, for bone and tissue, we grind the specimen with approx 1 ml of theo or chopped meat to make a thick paste, and that should be preferably in anaerobic chamber. Okay, if swabs are used, we wring out swab in 0.5 ml medium and do direct plating if possible. Okay, but it is less undesirable, and because we have already discussed that there's loss of organisms and there will be weak gram strain. Okay, for non-purulent large volumes, we generally do centrifuge, where we use the sediment for inoculation and gram strain. Okay, for orthopedic implants, some labs prefers sonication methods to recover the organisms from biofilms. All right. Now, processing specimens also includes inoculation of media, where we will learn about media types, inoculation techniques, and incubation. Okay. For media types, we use Brucella agar with 5% of sheep blood with vitamin K and hemin that generally used for general isolation. We use PEA blood agar to inhibit enteric gram-negative bacilli that reduces swarming. Okay, for kanamycin, vancomycin-laked blood sugar, it is used selectively for Prevotella and bacteroids. Okay, now for for Bacillus fragilis group and Bilophila wordsworthia, we use bacteroids bile, esculin, agar. Okay. Now, we use chopped meat broth or theo broth for enrichment for uh, for, uh, for utilizing enrichment medium. Okay. Now, PRAS media is also preferred as superior and it provides prolonged shelf life and is preferred over commercial reduced media. For inoculation techniques, one drop purulent or 2 to 3 drops of non-purulent per plate is uh, provided. Okay, now 0.5 to 1.0 ml specimen is used at the bottom of the broad tube. One drop evenly on the glass slide for a gram stain is smeared. Okay, with swabs in with swabs, if we use swabs, the inoculation first non-selective plates first will be preferred, and if two swabs is used, one is used for normal and one for gram stain, one for culture and one for gram stain. All right. Now, for incubation, we first have to place the inoculated media immediately in the anaerobic environment, and if the processing delays, batch process for multiple specimens can be performed together. That minimizes oxygen exposure. Okay, and we have to hold specimens in anaerobic devices such as bags, jars, or chambers until the incubation. Okay, anaerobes viability can last hours in the proper transport devices as mentioned in the previous slides. Okay, now that we have learned about specimen types, that acceptable and non-acceptable specimens, we have learned about the transportation devices, systems, and transportation methods, about the processing of the specimens. Now we will learn about the microscopic examination. Okay, so what we have to do for microscopic examination, first we have to do preparation of smear. Okay, for smear we have to first fix it gently via heat or fix it in an absolute methanol for at least 1 minute. Okay, for staining we have to use standard gram stain procedure and reagents. Okay, now what is the alternative of these reagents? Basic fusion instead of safranin, and with longer counterstain can be used that can enhance gram negative anaerobes. Okay, for what are the purpose of the gram stain? Gram stain, we will learn that gram stain reveals the types and relative numbers of microorganisms with host cells. Okay. Now, gram stain serves as QC measure, quality check measure. Okay, that provides the result that inform us about the adequacy of anaerobic techniques. Okay, it also provides rapid presumptive identification by correlation of specimen types and bacterial morphology. All right. Now, after smear preparation and observation of the gram staining, what we will get? We will get key gram stain clues. These are some clues that provides the information of these species. Okay. Now, an anaerobe species. For example, for large gram-positive rods, boxcar shaped, no spores, results, it shows that Clostridium perfringens is present. Okay, and it may appear partly gram negative in same paint. Okay, for gram negative Cocobacilli, the Prevotella or Porphyromonas species is considered to be present. Okay, now, thin gram-negative bacilli with tapered ends shows Fusobacterium nucleatum. Okay. For pleomorphic pale staining gram-negative bacilli or cocobacilli, it presents, it indicates that bacteroid species is present in the specimen. Okay. Now, if very small gram-negative cocci is shown or visible in the gram stain, it shows Veillonella species in the specimen. Okay. Now, what are the additional diagnostic guidance? First of all, we need to take care that gram stains may require new additional media or special stains. That means results of the gram stain may indicate the need for additional media or special stains. Aspirated materials from a lung nodule, for example, long, thin long, thin branching gram-positive bacilli provides uh, provides the information about the actinomyces or nocardia. Okay. Also, the stains such as modified quinone acid-fast stain may quickly provide useful information for the lab technicians. Okay. Now, for advanced microscopy, we all know that phase contrast microscopy or dark field exam are popularly used to demonstrate the spirosheets. Okay. Now, in our part 3 that will be coming soon, we will learn about the culture media of anaerobes and incubation techniques for anaerobic bacteriology specimens. Alright. If you have any query regarding this particular topic or any other topic, you can connect to any of these mentioned platform of ITLS Academy. Thank you.